So I realize we're running late, and I only have 3 objectives with my panelists for today's session. Objective number 1, we're going to talk about the future of MedTech. Objective number 2, we're going to talk about this in the backdrop of AI. And objective number 3, we're going to finish this in 30 minutes instead of 45 and try to save 15 minutes and give it back to the organizers and the audience. With that, I want to invite my esteemed panelists. I have the privilege to invite Commander Divya Prakash Joshi. Sir, Commander Divya Prakash Joshi heads R&D for Medtronic Global. I have been privileged to have worked under him for some time. Commander, landing straight from the US out here without your jet lag. Welcome, sir. I also have the privilege to invite Sushmita. Sushmita, I had the privilege to work with her in the innovation ecosystem earlier. She's been an innovation ecosystem builder. She's been an ecosystem builder with organizations spanning across an experience from organizations like Rich across. And Sushmita, really happy to welcome you out here. And then, of course, I have, someone out there who has been with me all throughout in this journey for the last decade or so, Rahul Paeth. Rahul has been taking multiple positions as a serial entrepreneur. Can I call you a serial entrepreneur? I think I can. And at the same time, he's also been a chief operating officer for perhaps the largest telehealth company at one point of time, and then the Math, which is AI for T-Hub. With that, I want to take up my... Who do we place out here? So do we place an agentic AI there or okay? No, that's it. I am Dr. Ambuj Chaturvedi. I head professional education for Johnson & Johnson MedTech India. I'm a surgeon by training. My last profile. Okay. And this is what happens, glitches out here. Mr. Gauri Shankarji, my apologies out here. This was not mentioned in the agenda. So please, a warm welcome out here. So as I was saying, bhool chook maaf kijiyega. Okay, you've already started my time. We have 24 minutes. This you've kept at 30 minutes, right? Oh, 35? 25. The targets just keep on getting tighter. So yes, so I'm a surgeon. My last position was as a head of neurotrauma unit with Fortis Noida, post which I decided to get into the management program. Have been in the corporate world for the last 16 years, spent time with companies like Johnson & Johnson, Covidien, Medtronic, a brief stint with BIRAC, Ministry of Science and Technology, then moved into IKP, ICICI Knowledge Park, and then I'm back at J&J right now. What I'm going to do is, I'm going to put in questions in, this is going to be a truly impromptu session because we're going to go all haywire, and the organizers have put a tough task on finishing this in 23 minutes. Let's get straight to the task. So we're talking about the future of MedTech. Maybe I could start with you, Commander. What do you see as the most compelling change that MedTech will see in the next 5 years, given the fact that you're looking at MedTech R&D from a global angle?
I would say that, connecting the devices
okay.
with the digital ecosystem and advent of AI, and also trying to move the care from the hospital to the home, and intelligent connected care, the whole paradigm across, the care does not happen only in the hospital, and wearable devices. I think that is where at a very large scale. The second piece that would also happen is in terms of, the combination of, or maybe the challenge which is being posed from a pharma tech to some of the devices, right? You come with a solution or a drug, and then how does a medical device company look at it? And thirdly is more with the use of AI, because we are in an AI conference, it's how does AI, the algorithms that we, the organizations build is really going to give the clinicians an easy way out, or maybe a path to a better, faster clinical outcomes. And there are some examples from Medtronic perspective, I would say, is that ADBS, the other is on AccuRhythm for, looking at false atrial fibrillation. and the GI Genius, which is looking at, polyps. And look, so it's a combination of moving from just devices and preclinical thing to digital connected care. And the patient has a say with applications in mobile applications for the clinician application, mobile applications for the patient.
So we have a technology perspective. If I actually pass on the gauntlet to Mr. Gauri Shankarji, do you agree with this? Do you have a more optimistic, aggressive picture, or do you have a more cautionary picture?
I think most discussions on AI, depending on whom you talk to, tends to get centered too much on the technology part of it, the replacement of doctors kind of a thing, where you're talking about care delivery systems. I think if I were to look at AI and its impact in healthcare, I would look at it at a four-tiered system. One is the actual care delivery, where you're actually being with the doctor or actually trying to supplement the doctor. Then the decision support systems is another area where you're going to analyze data, provide him with the kind of inputs for him to take his clinical decisions. The third aspect of it is where hospital efficiencies are being built. There's a whole lot of data which comes in from HIS. You're talking about patient appointment scheduling. You're talking about patient movement tracking systems. A whole lot of administrative skills, which is where a lot of delays, which puts pressure back on the care delivery happens. So that's another system. And the fourth layer of it is, how are we actually going to ensure that the care providers are up to date with whatever the latest technology and the developments are happening? Because that's a very important layer which often gets ignored conveniently. You ask a hospital administrator, he will say that they come with qualifications so they know what they're doing. Whereas the way the tech is moving, the way the care delivery is moving, the amount of technology which is coming in means that our education system is archaic. By the time you graduate out of your med school or your nursing school, already your knowledge is dated. And you're coming in straight away, you're dealing with modern equipments like what doctor said about latest diagnostic systems or invasive robotics and a whole lot of things. And you have the least clue about what actually you're doing. So which means that knowledge needs to be constantly updated to know how to use these technology tools. And that's another area where, and knowledge has to be very validated knowledge. Otherwise, like the previous speaker, Dr. Reddy, was telling you about, you get into a whole lot of hallucinations, whole lot of wrong information told very confidently by AI, and you get sidetracked on the whole system. You think you know, and that's what happens when patients come with ChatGPT kind of information to doctor. And I had one of my doctor friends asking me that she's an ophthalmologist and doing a LASIK surgery, and a patient reads up, he's an IT professional, he comes and says, I read that there's a 0.1% chance that I will go blind. How are you ensuring that I don't fall into that 0.1 system? And the doctor says, how do I answer this question? So I think it's a more nuanced thing. It's a kind of a V curve. AI decisions today are being made more from a populistic point of view or a kind of a euphoric marketing point of view. I want to be in the AI bandwagon, otherwise I'll be left out, so I just do whatever is there. And then on the other end of the spectrum are people who are very skeptical about AI, and they say that, are they very suspicious about AI, and they say, am I going to, is it going to replace me? But the answer lies somewhere in between.
I know there is one set of people who are not skeptical about AI, and they are the people who were the earlier investors into SpaceX. I mean, we have that fresher news. Someone who becomes a $1.7 trillion, creates a $1.7 trillion empire. It's somewhere. But anyways, jokes apart, I would say, so if I summarize what you said, you talked about, AI is not just about technology, there's also a human component. Point number two, there is a certain learning curve that we have. And point number three, it's not siloed. It has to be, you need to have a systems perspective. Now, coming to systems, then I would want to have Sushmita put her point. You've been building the ecosystem all throughout. What has been your experience in 1 minute, and what would you have it be in the next 2 to 3 minutes, 5 minutes?
Okay, systems is hard to change. That has been my experience. We all come with very strong systems. That's the thing with AI in healthcare as well. Hospitals also have their workflows very, very tightly guarded. And these are workflows which have been guarded from their educational perspective as well. So from their training to the practice, it has always been the way it has been done. You take the report, you come to me, I give you the prescription, you go collect, and things are set in place. Now you are bringing in a technology which will disrupt their system, which will disrupt their entire workflow, how it has been managed. So it is a lot of times breaking the system which they thought was operationally efficient. So AI in healthcare in some ways has to become the infrastructure layer on which the healthcare is building on so that it can flow into their existing workflows. Otherwise, it will never be adopted. That was my bigger learning because we saw a lot of startups build just a SaaS, a layer on top. But when you come down to the hospital, you see that they never had the data to work with, or they were never even collecting the data to implement their layer on top. What on the other side, now that I see in the regulatory space with my current role, I see the medical devices companies which had a software in place and collecting data, they build that AI layer on top very fast and get access, and that AI tools are fastly adopted in the healthcare practice, partly because they had the digital already in place. So understanding these nuances of which kind of AI tool, which kind of AI analysis would get into practice fast and implementation is the key. So systems is hard to break. If you want to rework on the system, start with low hanging and then go to the difficult ones. So future is for those who understand the system well.
So you started off on a very cautionary note saying systems are hard to break, and then you kind of ended it on an optimistic note saying, yeah, people who understand it are going to make it. Let me now come to the young Turk, Rahul. You like being called young, right? Everyone does. Rahul has this unique blend of working both as an entrepreneur and then getting into working on the ecosystem side with T-Hub and the works and all. Rahul, what would be some of the top 2 or 3 problems that entrepreneurs would want to solve, given the fact that there's an ecosystem to support them? So there are certain esoteric problems that entrepreneurs might want to solve, but the ecosystem, at least, let's talk about India, let's talk about India, may not be ready for it. That happens. दोनों का match करके, matching both of them, what would be those 2 or 3 options that you think?
In healthcare.
In healthcare. So there he goes.
Yeah. So thanks, Dr. Ambuj, and thanks everyone for bearing me once again. 3 area problem statements, if I will ask. One is that I will break it down into 3 categories, like a quick win, where an entrepreneur can build a solution, they can make quick money, and that will be your operational efficiencies in the healthcare system. Healthcare, when I say, I also consider MedTech, pharma, and everything. So be it their supply chain, manufacturing, wherever you can go, basically how you can make that system more efficient, be it impacting the logistics, supply chain, those things, be it in a hospital, how you can make the hospital systems more efficient, the hospital management systems. Those are the low hanging because there is no direct impact, or you're not impacting the doctor or the patient directly. It's more on the support system or the ecosystem side. These are the low-hanging ones, where it is easy to convince the stakeholders, easy to get paid and make some money, and show some ROI and output. So this is, I will say, the quick wins or the easy ones. Second one, where a lot of investments are already happening, a lot of people have burned their fingers, but still there is an opportunity that something great can be done, is radiology or diagnosis, basically. Not exactly just radiology, I will say overall diagnosis. Yeah, radiology is one part of it. So diagnostic areas are the areas where AI is playing a major role. So that areas like be it your automated reading of CT, X-ray and all these things. Okay, the systems are semi-matured, not that matured, but they're making the progress. Their investments are coming, funding is coming, everything is there. So that can be the second area. Diagnostic also in the sense of like your pathology reports, not just always the imaging, but the pathology report, how you can do the predictive analytics kind of thing, which most of the diagnostic centers have started adopting, and they are working towards it. The blood report, when it is coming, how you can make it more predictive, how you can predict things for the patient, futuristic, be it in diabetes or any other case. So how multiple parameters can be combined together, and how some magic outcome, or some prediction can be thrown to the patient, how you can make it more enticing basically for your end user, so that he starts using it. Now, in these things, there are 2-3 streams of products are coming out, or there is an opportunity. One is that how you entice the patient, how you entice your doctors, because how the doctors are finding it useful for them to treat the patient. And third is that how they can use this data for hospitals to increase their patient footfall. So there are 3 angles towards it. The third category, which is the most expensive one, and that is the clinical support decision-making system, right? Now that is an area where, doctor, and many people know, the work is going on for ages, almost like for a decade or more than a decade. Actually, people are working. Major breakthrough has not happened. This is a very expensive system where actually it is kind of trying to replicate a doctor, how he is treating a patient and how he is interacting with the patient. Lot of systems have come into the market, nothing of great success, or that I can say, okay, I will not go to Dr. Ambuj, but I will go to this system. That we are not yet able to reach. I don't know when we will reach that stage, or ever we will reach that stage or not, but that is the system where the big money people are betting. I am sure Yashoda must be having some form of this kind of system. Apollo is already having some form of this kind of system, but they are not at their best level, or they are not giving the best of best outcome. But these are the areas, if someone can break it, or make it happen, that is where the big money lies. Okay, but that requires also big investment. Huge amount of data is required, huge amount of knowledge is required, huge amount of training is required. And it's a time-taking process. It's a heavy system that we are trying to build out, anyone who tries to build. So I will categorize it into 3 ones. One is a quick wins, as I told you, the operational part. Second is more on the diagnostic thing. And third is more on the clinical decision support.
Awesomely put. So for the audience, I will just simplify this further. So what Rahul has done is, if you take an X and Y axis, you put impact on one axis and feasibility on the other axis, he's basically mapped out the entire possibilities for you. Organizers, how much time more do we have? How much time more? Sorry? 10 minutes. Awesome. So yeah.
Ambuj, I wanted to just add a comment. One is workflow in hospitals. So I'll speak from what we do, what we diagnose, we treat. And I'm talking of use or AI in devices. So there is an outcome, which means we are trying to alleviate pain, restore health, and extend life of a patient, because there is a good interaction synergy between a clinician, a technology, and the hospital network overall, because we need the infrastructure. So basically look at adaptive DBS, wherein use of AI, given what are the electrical signals coming, what are the potential, the pulses for rigidity or flexibility are monitored. So now you don't have to run every time to a clinician and say this is what is required. So I would focus on saying that there are a lot of things of improving efficiencies and workflow, which is important. But from a device perspective, the more you build the AI into this, the more granular or like a targeted drug delivery, similar thing can happen. So those were my little comments.
Yeah, those are interesting. Any other points related to the realism that AI has versus the fantasy that we are dreaming about? Anyone can take up this point.
Human in loop is unavoidable. It can be a technologist, it can be a general manager, it can be a clinician, but you cannot take the human in loop out of the system. That's all I would say.
I will just add one thing there, like real versus fake, what we say. So I was just sharing it, one of the sessions I was taking in some of the B schools, and there it was all healthcare workers, and definitely somewhere from Medtronic, J&J, and obviously like many of your known colleagues probably. So one thing that I will say, and that was like all the, my learning and what I shared with people is that real in healthcare, when you are talking about AI, is something which is validated by clinical outcomes and or operational efficiencies, and has a real outcome, or the ROI is measurable. fake is something where there are a lot of, and this I'm saying from early stage innovators to even big MNCs, it happens that, fake is something, fake AI, what in healthcare is something where it doesn't take care of your regulatory aspects. It doesn't take care of your, as he said, human in loop. So what we say, the human factor is completely missing out of it. And third is that where the claims are so high that they are unrealistic to match. Like if I say that I will replace a neurosurgeon from this theater in next 1 year using my AI-driven robotic arm, that is a very unrealistic kind of claim. So, that's how the real versus actual AI or the fake AI, that's how we differentiate. And that is what we also take it as the benchmark to identify which healthcare startup is actually making some sense and which is not making any sense. So just 2 cents.
For me, the biggest scare or threat for the future is, you said human in the loop is necessary. The human in the loop is able to differentiate real versus fake, validate it, is because the human has been trained to see the truth. But if you're going to use AI in early on in your career, because right now the messaging is that if you don't use AI, the doctor get replaced. So you have to be a doctor who uses AI. And if that is going to train you, how are you going to build your skill set? How are you going to build your wisdom in medical technologies or medical practice in essence? That is going to be difficult. So recently there was a paper which said early introduction of AI would lead to never skilling of the doctor. And that scares me a lot, which we have seen in the education system as well. If you introduce prematurely, the nerve cells don't develop, you don't use your memory, you don't enhance, you don't go through the challenge of learning. Learning has its own way of building it. So now, introduction of AI prematurely to the doctors is something that worries me. How do you differentiate a doctor who is valid enough to validate it, and how does it work?
This discussion is getting even more complicated than AI, so yeah.
No, it is a complex system because we have a very fractured kind of data system which we do have. Not every hospital is using AI compatible or a digital compatible data, and patients do not stick to any one healthcare system that they're going into. And in a place like Hyderabad, where a lot of patients are coming from rural Odisha, the Northeast, and everywhere else. Now, they are coming with incomplete or fractured kind of a data or a false data. Any diagnosis, any inference that a doctor makes is based on a whole lot of clinical history taking and also looking at past data. But if he's going to take on episodic data and make an inference on that, that's one problem that I do foresee. How is this? It's more than a problem, it's a challenge which is posed to AI is one thing which I would look at. The second part of it is the bias. Now, there is medical heuristics. Now, doctors use their judgment. Now, how is that going to be mimicked by an AI? How is that kind of, and in a country like ours where we have every 50 kilometers you travel, the medical compositions are different, the people are different, and their lifestyles are different. So does one kind of an inference and a training or a treatment plan work for all? Now, that will require the AI to work on a lot more data before it is going to reach there where we are able to say that it is really something which I can depend on. The risk, like she said, is that when you're going to have younger doctors who do not have, we have a very unique problem. The senior medical fraternity are retiring. The younger medical fraternity who are coming in lack the experience and the medical data. If you're working in a corporate entity like a Yashoda Hospital, you're going to see a particular socioeconomic strata of patients. Whereas if you're going to go and work in a government hospital, you're going to see a completely different segment of population. Now, how does the learning work across here. And that's something where AI can play a huge role. But that will depend on the kind of data which is available to AI to models to train on. And that's something which a lot of work needs to be done.
So yeah, so if I actually summarize in the interest of time, we understood that, so the question was a loaded question actually, not something to be finished in the couple of minutes that we did, but an admirable panel that I have today. So we talked about human in the loop concept and said, this is what can safeguard AI, and kind of put guardrails around how the application has to be. We talked about its impact, the realistic part of AI which needs to be considered when we are evaluating whether this technology works or not. We talked about the scare around it, which is good. Some amount of fear is good. So whether we will be able to learn or not. We talked about contextual learning, so it's not episodic learning. In fact, Sushmita, one point. So my kids were talking to me about AI. They said, it's fantastic. I said, no, the more time you spend on video games, you're not going to be learning on your own. They said, no, Baba, you've seen the Matrix. So one of my favorite movies is Matrix. So you saw Matrix? Trinity was able to download the entire driving program for the chopper in a matter of seconds. I said, yeah, but you also have to remember she was in the Matrix. Her reality was she was a human battery. So the point is, it's got to be, it doesn't have to be episodic, it has to be contextual. Dear organizers, it's 23 minutes, so I'm going to wrap up the entire session in the next 2 minutes. We've talked about various nuances about AI. We've talked about various aspects, the optimistic and the not so optimistic part of AI, which is great. We need to have both the sides considered. We've talked about what the possibilities here are, and I think that is where different aspects, different perspectives were given. All in all, if I want to summarize, I would say, and I would actually want to put to the audience to the poll, but how many are optimistic about AI in healthcare in the future? And that's substantially good. How many of you are cautious about AI in the future? Okay. That's a significant number. How many of you are, or should I just say the total audience minus A plus B? Is that what it is? How many are pessimistic about AI in the future, AI in healthcare in the future? Oh, this is redeeming, it's encouraging. I think this is one of the ways in which the conference would actually have achieved its purpose. So if we are optimistic or even cautious about AI in healthcare, I think this conference and its fantabulous set of panelists, not just the panelists with me, with whom I've had the privilege to interact, but the overall set of speakers that we've had over the entire 2 days, I think we've served our purpose. With that, I want to thank the audience, I want to thank the organizers, I want to thank Dr. Chinnababu. I mean, he's been a good friend for so many years, but this entire event has been brought on by the efforts of all of us. With that, dear organizers, I offer you 20 minutes back to you and the audience.